Gastric cancer is cancer arising from the stomach. And in the early stages, gastric cancer does not, unfortunately, have a lot of symptoms. The symptoms can often be very vague and things that may be seen with other common diseases, such as gastric ulcer disease. So people can have some nausea, feeling of fullness, sometimes some vomiting. Now, as gastric cancer becomes more advanced, you start to see more symptoms such as what's called unintentional weight loss, which is you're not trying to lose weight and you're losing weight. Jaundice or yellowness of the skin is a late sign, as is getting weight gain around your abdominal cavity. About 10% of gastric cancers are what is called a familial disposition. That is, it runs in families. 3% of all stomach cancers are hereditary, and of those, the most common form that we know about today is something called hereditary diffuse gastric cancer. This is from a bad gene or a faulty gene that is passed on from one set of parents called CDH1 or cadherin1. And in patients who inherit this gene, they have about a 70 to 80% lifetime risk of developing gastric cancer. They also have a 50 to 60% risk in women of developing a lobular breast cancer. Now, for patients who have the CDH1 gene, we recommend that they get endoscopic surveillance or a camera test looking at the insides of their stomach starting in their teenage years. Unfortunately, that's not perfect because the cancer can still hide in the stomach despite an endoscopic examination. So for patients who have this inherited gene with CDH1, we would recommend a prophylactic gastrectomy, which means take out the stomach starting in their 20s. So there have been many advances in the last decade in the treatment of stomach cancer. The advances can be grouped in two categories. Advances are often seen in the genetic era or precision medicine. And we know that gastric cancer is no longer just one cancer, but many different types of cancer. And understanding the right genetic part of that stomach cancer helps us find the right treatment. An example of that is 5% of all patients with gastric cancer have a gene that is also seen very commonly in breast cancer called HER2/neu. So if we know that a patient has this genetic change, we can then offer treatment that was used in breast cancer, but is now used in gastric cancer also. Alongside, we've seen advancements in the surgical treatment of gastric cancers. Some of those start very early in how we stage the gastric cancer, that is, using endoscopic ultrasound to determine if the cancer has spread to the surrounding lymph nodes. There have been a lot of advances in the surgical treatment of gastric cancer using what's called D2 lymphadenectomy. And that's a big mouthful, but it means taking out the surrounding lymph nodes, not only around the stomach, but also in nearby organs where the cancer may spread, such as the liver, the pancreas, and the spleen. And of course, we are using cutting-edge surgical treatments, such as minimally invasive surgery, to manage gastric cancer. It's best to find gastric cancer early. If it's very early, we can treat it even non-surgically with our help of our GI colleagues. In early gastric cancers, often the treatment is only surgery to remove part or all of the stomach. In advanced stages, when the cancer has spread to the lymph nodes, treatment is often multimodality, which means not only doing surgery, but other forms of treatment to give the best outcomes to our patients. Often we use chemotherapy prior to surgery and then move on to the surgical aspects. And this is based on large clinical trials that show that patients who get chemotherapy prior to surgery have better survival in the long run than surgery alone. In the very advanced stages, such as stage 4 cancer, where the cancer has spread to other organs, we have very exciting treatment options available. Immunotherapy has shown benefit in selected gastric cancers and shown great responses. At Johns Hopkins, we also offer novel surgical options for stage 4 disease, where the cancer has spread inside the abdominal cavity, and we offer aggressive surgery along with HIPEC or heated chemotherapy as an option.